first, let me introduce myself. My name is Dr. M. I am the education chair here at the CCA, and I have the pleasure of interviewing Dr. Ken Sheridan, who I'm so excited to be joined with today. Dr. Ken, tell us a little bit about yourself.
My name is Ken Sheridan. I've been practicing in Colorado since '96, and I was licensed since 1990. Went to national. My uncle was a chiropractor on Long Island when he was practicing against the law, and I'm glad we don't have that problem anymore. But and I have 3 cousins who are chiropractors, so kind of runs in the family.
That's got to be a fun holiday party, whatever holiday you're at. I want to be
Well,
there.
you know, 4 chiropractors in a room, you get 6 opinions.
True. So true. Awesome. And what got you into chiropractic? Like, what made you decide, yes, I want to go to chiropractic school?
I broke my back when I was 12 years old. Spondylolisthesis, grade 2, 40% slippage, and they wanted to do surgery, and my uncle said, no, there's a better way, and the rest is history. I didn't have to have the surgery till 2005 instead of in 1978 because of what my uncle did.
Wow.
And then, so beneficial for my life as well as those around me, evidently.
Totally. And that helping you for that long was like, yes, I want to do this and help others.
Sure.
Very cool. Awesome. Okay. Tell us a little bit too about your favorite chiropractic case so far. Like, what's your favorite story to tell on one of the patients that you've been helping?
Oh, gosh, lately, we do a lot of athletes here. So just getting athletes to be able to complete what they're training for and nursing them through injuries, whether it's tennis problems or we work on a lot of endurance runners and triathletes. So getting them through their thing. One of the ways I know I'm a great doctor is that one of my patients who was going to Berlin to compete in the marathon sent me a report a few days after the marathon telling me that she tried the Rodler, but she found a wheat beer that she liked better after the marathon. So that's how I know I'm doing a good job.
Heck yeah.
It's not just about their injuries, it's about making a connection.
I love that. That is awesome. Cool. Well, what are you going to be teaching us at our Mid-Year REV Up this year? What's going to be your topic? What are we going to learn from you?
Okay, so like I said, I've been in practice 33 years, and I'm tired of going to seminars that get bogged down in statistics and don't give you anything you can use in the office on Monday morning. So we are going to start, and I know my subject matter says low back and hip, but we're going to start with the hip because I think that I might have more to share about the hip because we're all pretty good at low backs. And then we'll get into the low back thing and with the time we have left. But I want to make sure that we cover the hip and have people practice enough so that they can actually use it Monday morning.
Yes, totally. I love that. I always say, I'm like, I feel like when I go to a seminar, whether it be about pediatrics or migraine or whatever, those patients then show up on Monday morning. I'll have like no sign up for whatever you just learned about, So I'm super excited that you have something to teach us that will be able to apply to our offices and clinics, and then also bring us some new patients in that area as well.
There we go.
Awesome. Okay, so anything else you want to tell us about it?
I am a kind of a mixer. I do because of sports injuries, I do a lot of soft tissue stuff, biomechanical analysis, and we're going to be covering enough of that, but also some lower force techniques that you can use comfortably on older patients or more acute patients. Okay. So it's not just the young athletes, it's also older athletes who are trying to stay in the game, and older people who are perhaps more sedentary as they get older. And I want people to feel comfortable treating their hips and analyzing their hips without sending them into a tizzy or aggravating their condition.
Totally. I love that. That'll be cool. Athletes at all walks in life, right? It doesn't have to be the 25-year-old competing in the triathlon. Anybody who is moving, technically, we can consider an athlete. We're going to find out how to help them. That's super cool. I love that. Awesome. Well, we're going to wrap things up here, Dr. Sheridan. So, as a reminder, guys, if you have not signed up for our mid-year rev up this year, you're going to want to do so. It's June 9th and 10th in Glenwood Springs. And it's going to be awesome. It's one of the only seminars where we have a vast variety of different doctors teaching, all mostly based on techniques. So we're getting so much out of this that we'll be able to directly use come Monday morning. So definitely want to get signed up. Prices go up May 19th. So make sure you get signed up early. You can check out our website or look on your inbox and tell your friends. We cannot wait to see you at the Mid-Year Rev Up this year.